Welcome to this 5-minute learning video about the clinical detection of hypoxemia. Hypoxemia is defined by low levels of oxygen in the blood. Chemoreceptors throughout the body detect when oxygen levels are low. There are central chemoreceptors in the medulla oblongata located in the brain, and there are also peripheral chemoreceptors in the carotid bodies and the aortic arch. When hypoxemia occurs, the respiratory centers in the brainstem respond by increasing ventilation. Usually this occurs through increasing the respiratory rate or number of breaths per minute. Patients may experience a sense of shortness of breath, also known as dyspnea. It is important to note that chemoreceptors also detect and respond to pH and carbon dioxide. Increased carbon dioxide, known as hypercarbia, is usually a stronger stimulus for breathing than is hypoxemia. In adult patients, early signs of hypoxemia can be restlessness and anxiety. Using pulse oximetry is an easy and non-invasive way to measure oxygen saturation. Although not all signs are noted in all patients, clinical signs of hypoxemia in adult patients can include rapid breathing, fast heart rate, accessory muscle use, an upright position, an inability to speak in full sentences, and confusion. A late and ominous sign is pallor or cyanosis. Pediatric patients, unlike adults, may not be able to alert providers or report dyspnea. Further, clinical signs may be inconsistent or nonspecific for pediatric patients. Use of a pulse oximeter is the quickest and easiest way to detect hypoxemia in all patients, but especially in the pediatric population. Other signs of hypoxemia in pediatric patients include a weak cry, lethargy, grunting, an inability to feed, fast breathing, wheezing, a tracheal tug, retractions, nasal flaring, head bobbing, pallor, and cyanosis. Here's an interesting fact. The normal values for the fraction of inspired oxygen concentration decrease with an increase in altitude. Therefore, normal oxygen saturation is less for our friends that live in high places, like the highlands of Peru, Tibet, or Ethiopia.